So I'd like to introduce two of our speakers for tonight. We have Dr. Michael Brauer. He's a professor in the School of Population and Public Health at UBC, and he directs the BRIDGE program, which is a strategic training program linking public health, engineering, and policy. His research focuses on the health impacts of air pollution, and he's participated in many studies throughout the world and served on numerous advisory boards for the World Health Organization, the U.S. National Academy of Sciences, and the Royal Society of Canada, as well as the International Joint Commission on Governments in North America and Asia pertaining to the impacts of air pollution on health and health policy. Our second speaker will be Stephan Van Eeden, who's a colleague of mine at St. Paul's Hospital. He's an internist here and a respirologist, and he's a professor at the University of British Columbia. He graduated from the University of Stellenbosch in Cape Town, South Africa, and then after 4 years as a family practitioner, he resumed his studies in internal medicine at the same university. He was trained and certified in pulmonary and critical care in 1985 and then did his PhD in experimental medicine at UBC under Dr. James Hogg as his supervisor. And he graduated in 1995 and then completed his Canadian specialist exam in 1996. He's a principal investigator at the James Hogg Heart and Lung Institute here at St. Paul's, and his clinical and research interests are in lung disease, particularly chronic bronchitis and emphysema, lung infections, as well as the effect of cigarette smoking and air pollution on these conditions. He's the director of the COPD Chronic Disease Program at Providence Healthcare, and his research efforts have resulted in more than 110 peer-reviewed publications. So without further ado, I will invite Dr. Brauer to be our first speaker in this presentation. So, air pollution and health, Dr. Michael Brauer.
Thanks. Thanks, Anita, and thanks to all of you for being here. I'm always impressed, actually, when it's not pouring outside, that people actually come in and listen to somebody talk. So really looking forward to actually talking with you and trying to answer your questions. So I'm going to talk kind of in a general sense on air pollution and health, and then Dr. Van Eeden's going to actually drill down into the details, sort of at the molecular level, actually what happens. So here's what we know, and we've actually known this for quite a long time. On days with worse air quality, we know that more people die. And in fact, more people die from cardiovascular disease. So that actually might be a bit of a surprise, that you'd actually think because we're breathing in air pollution, it's respiratory disease, but it's actually heart disease that is the big killer linked to air pollution. We also know that if you happen to live in a more polluted city in the world, that you will die earlier than people who live in less polluted cities. And again, this is primarily due to cardiovascular disease. And more recently, we've actually started to understand that it even matters where you live within a city. So if you happen to live in a particularly polluted neighborhood, or even a particularly polluted part of a neighborhood in a city, you're at an increased risk of dying, again, from cardiovascular disease. And I've just been talking about death, but this little graphic here sort of shows you that there's a whole range of health impacts associated with air quality. Obviously, death is the most severe. There may be things that we can hardly feel ourselves, so subclinical effects, that we can measure on a molecular level, but then certainly symptoms, impaired function that may require us to seek medical care, maybe even be hospitalized. So that's kind of what we know. You could ask yourselves, why don't we notice this? I mean, I could probably ask for a show of hands who's actually felt affected by air quality. I'm not going to do this just in the interest of time. I probably get about half of you raising your hands. Air pollution risk for any one person is actually rather small. So I don't want anybody to walk away this evening with the impression that, if you are walking behind a bus and there's a plume of diesel exhaust, you're going to drop dead that moment. It's really not the way it works. It's a small risk, but it adds on top of other risks that we face in our lives, so diet, physical inactivity, et cetera. But why is it important from a public health perspective is because all of us are exposed. We all have to breathe, and if the air that we breathe is polluted, we're all affected in some way. You can contrast this with something like smoking. So if you happen to smoke, the risk for yourself is very high. But fortunately, not that many people in our society smoke anymore. So the actual exposed population is rather small. So that's an important sort of distinction. Also, air pollution affects disease progression. So it's a kind of a slow effect. There may be some very acute, very immediate effects. Certainly we may experience those if you've been exposed to very high levels. You may experience acute irritation, but generally the effects are on chronic disease progression. It's adding to the development of a disease. And again, the diseases that are impacted by air pollution have other causes. So we have to think about air pollution as a contributing risk factor, not the one thing. So one implication of this is that if you're healthier in general, all those things that you're supposed to be doing, exercise, good diet, et cetera, that's actually going to reduce your risk of being affected by air pollution. So that's just an important message just to remember. Here's where things are sort of globally. This figure on the left-hand side here, don't look at the details here, but these are actually the causes of death in the world. The greatest cause of death in the world is high blood pressure. Second to that is smoking, et cetera, et cetera. Air pollution is associated with about around 1 million deaths a year. That's outdoor air pollution. Actually, the greatest effect of air pollution in the world is indoor air pollution from people cooking with solid fuel. So about half the world's population actually cooks over an open fire. Any of you who've been camping recently, you know that fire smoke can be quite irritating. Imagine somebody doing that every day of the week for their whole life. And that's what many women in the world face, and their children also face this kind of exposure. And that's responsible for about 2 million deaths a year. Of these 800,000 deaths attributable to outdoor air pollution, the vast majority of these are actually occurring in rapidly urbanizing Asia, so China, India, Southeast Asia. This map here sort of shows you levels of air pollution in the world. So red, dark red are the higher levels. Blue are very low levels. You can see actually Canada in general, certainly Vancouver. It's actually some of the cleanest air quality in the world. To put it in more perspective, here's just levels of air pollution in major cities in the world. Vancouver's not even on this, so it's the lowest here. So Seattle is actually on the far right side there. All of the cities on the left-hand side in Asia are the highest in the world. So Vancouver's, for a city of its size, is one of the cleanest cities in the world. That's good, but here's the bad news. Even in Vancouver, we're still estimating somewhere around 700 deaths per year attributable to air pollution. We can't measure this precisely. There's no air pollution disease so that somebody shows up at a hospital and we can actually detect something. So we do this statistically based on studies, but these are I would say, relatively precise estimates of air pollution. So what does this mean? It means it's about 5% of the non-accidental or non-homicide deaths that occur in Metro Vancouver are actually attributable to air pollution. So it's not a tiny player. It's not the biggest thing either. And in Canada, this number is around 6,000 deaths per year. How does this work? Well, there's a few ways that air pollution can actually lead to death. We know that actually as we grow, that our lung function improves up to a point actually where we stop growing. And afterwards, it's all downhill. Sorry. And if you happen to smoke, that decline in your lung function actually is increased to the point where at some point you may be disabled. So your lungs actually aren't able to provide enough oxygen so that you're actually disabled. What happens is if as you're growing, you don't attain your maximum lung function, you're already at a deficit. So by the time you're 18 or 20, when you've actually stopped growing, you're already at a deficit, and that's just going to make it more likely for you to get to a disabled state earlier in your life. And what we know is that actually air pollution reduces lung function growth in children. So this is a study actually in California, looking at children actually and measuring their lung function as they grow from age 5 to age 18. And the rate at which their lungs grew was affected by the level of air pollution in their city and actually in the part of the city where they lived in. So if you're a child that grows up in a more polluted part of the world, your lung function will never achieve its maximum level. That then sets you up for earlier disability or perhaps death in your life. We also know that air pollution is linked to the progression of atherosclerosis. So this is actually the main killer in our society, is development of cardiovascular disease linked to development of atherosclerosis. And we can measure this. Several studies now have looked at the amount of plaque in our arteries, and that's associated, again, with air pollution exposure, primarily where you happen to live, so long-term air pollution exposure. You may ask yourself, what's the government doing about this? Don't these standards that we have protect us? Well, actually in Canada we don't have any standards, we just have guidelines. But even standards are not protective. We know actually that air pollution has no safe level for the population. There will always be people that are super sensitive and will be affected essentially at any level above background. So it's really a question from a policy perspective of what level of risk are we willing to accept, and how much are we willing to pay to reduce that risk. Fortunately, air pollution management we know it's actually very good value for money. And the ratio of sort of what you have to spend to reduce air quality in terms of the benefits you achieve is at least 4 to 1. So for every dollar you spend, you get $4 back in benefits. And don't ask me how we quantify this, but it can be done. Some estimates are as high as 30 to 1. And actually in the US, they have to do this. For every regulation that they pass, they actually have to do a cost-benefit analysis. And air pollution, of all the laws passed in the US, is the most cost-effective law of all. So it's very, very good value for money. And we have successes. So this is actually a picture of Falls Creek in 1939 at noon. That's what it used to look like. This is what it looks like today, right? So we know actually that we can achieve successes. So this is not a situation where it's hopeless. We've got many sort of air quality management programs that we are just accept now today. And we know that these have health benefits. So here's really a landmark study that was published in the New England Journal of Medicine a few years ago. And it looked at reductions in air pollution in the United States over about a 20-year period. So as a result of many regulations, air pollution has been improving. It's been going down all over Canada, all over the United States as well. And then line this up with changes in life expectancy throughout the U.S. And so the places where air pollution decreased the most, life expectancy increased the most. Places where air pollution decreased the least, life expectancy still went up a little, but went up less. And it's estimated then that air pollution reductions accounted for almost 15% of the life expectancy that was experienced in the U.S. over this period. And so there was a total of about 3 years improvement in life expectancy. A lot of that's due to improved health care, changes in diet, occupational diseases improved, et cetera, but air pollution about 15%, and that's huge. You think about all the other things we're trying to do to improve our health, getting a 15% improvement in life expectancy over a 20-year period is huge. So again, it's very cost effective to do something about it. So where are we today? What are some remaining sources of air pollution in BC and in the Lower Mainland? Well, I would say the two main ones are vehicles, and even though our cars are about 99% cleaner than they were in the 1970s, we have so many more of them that they're still a major source of air pollution. That's one, and the other one is actually somewhat surprising, which is burning of wood. We actually don't see many people sort of, using wood-burning stoves even, in the Lower Mainland, but even just recreational use of fireplaces and wood stoves for ambiance, it's a major source of air pollution that has actually gone relatively uncontrolled. So here's the situation with traffic, is that we have very sharp gradients in air pollution as a function of distance from roads. And we know that actually if you live somewhere between 300 and 500 meters away from a major road, we can actually measure higher levels of air pollution in those zones compared to people that are farther away. And if we look sort of more specifically at try and measure health impacts, certainly people who are living between 50 and 150 meters from major roads, we can definitely detect a health impact. How many people are in this exposure zone? Well, it's almost half the population of Vancouver is living. So we don't have big freeways. That may be very good, but that means it's not too far for anybody to get to a major road. Now, if you happen to live in Los Angeles where there are big freeways, then this zone is actually much greater. So you sort of can't win either way you design your city. So we've actually taken this information, we've done lots of measurements, and now we can actually have very detailed maps of air pollution. So this is kind of what traffic-related air pollution looks like in our region. So we actually know where the highly polluted areas are and where the less polluted areas are. And again, generally it follows sort of road density and to some extent the types of vehicles that are on the road. So before you say, you know, where do I live? Am I good or bad? I mean, again, think about where you are in proximity to major roads. But obviously not all of us can move away. So we need to think about how do we actually approach this problem. What do we know about health impacts? So from our studies, certainly we focus mostly on children. We know actually that if you are pregnant and live within 50 meters away from a provincial highway, you have about a 20% increased risk of giving birth to a low birth weight baby. Increased risk also of having a premature birth. Bronchiolitis, which is actually the main reason that children in the first year of life become hospitalized, so it's a respiratory infection. And obviously it's an infection, so it's not caused by air pollution, but air pollution interacts with our defense systems and our immune system to make it more likely that infection won't be cleared, and so that it will become severe. So this infection, if you live within 50 meters of a provincial highway, you have a slight increase, a 6% increase of developing bronchiolitis. Asthma, I think many of us know how important asthma is in terms of a respiratory disease. And from a number of studies, somewhere around 15% of new childhood asthma is attributable to traffic-related air pollution. So you're more likely to develop asthma if you are exposed to higher levels of traffic-related air pollution. And here's another one that's kind of interesting is ear infections. About 10% of the cases of ear infections are attributable to traffic. How does that work? It's not the pollution's going into your ear. Ear infections actually start as upper respiratory infections. And air pollution, again, makes it more difficult for you to actually clear those infections. They progress into the ear canal, and that's how you get ear infections. And those of you who have been, around children experiencing ear infections, sort of what a horrendous situation that is for a child, very, very painful, and has all kinds of spin-off effects. So parents have to take off work to care for their children, for example. And it's also associated with, that's the main reason actually children are prescribed antibiotics. Looking at adults, we did a really interesting study a few years ago, again, looking at where people lived. And well, I'm not even going to explain the figure. I'll just describe to you this study. We separated people into 4 different groups. We had people who never lived near major roads, people who lived near major roads for the whole period about a 10-year period, where we were following their health. Then we had people who either moved towards a major road or moved away. So the people who never lived near traffic were sort of our baseline. Compared to them, people who live near traffic over this 9-year period, they had about a 60% increased risk of dying from cardiovascular disease. So quite substantial. The people who, during that period, moved from a cleaner area towards a major road, their risk was almost like the people who were always living near traffic. Now, interestingly, the people who moved away, their risk dropped down almost as low as the people who never lived near traffic. So this is kind of like quitting smoking. So if you quit smoking, you don't improve your health just like a person who's never smoked, but you get a big benefit. And this is air pollution, quitting air pollution by moving away. Now, not all of us can do that, but we need to think about what if we move the air pollution away from the people, which is really what we ought to be doing. And it seems from at least this study that you get a pretty profound benefit from doing that. So I'm just really quickly going to talk a little bit about wood smoke and what's the concern? Well, it's something that's sort of been important in Canada. It's part of actually our natural fiber. In fact, there was a ban put in place in Montreal a few years ago on new wood stoves in new home construction. And the next day there was an editorial in the Globe and Mail saying, you know, this is an assault on the Canadian identity, et cetera, et cetera. So it's important. We've got a lot of wood to burn. And actually we know when other heating fuels, the prices increase, that more people actually turn to this. It's primarily a problem outside of major urban areas, but surprisingly it also exists in urban areas, including ours. More recently, it's actually been promoted as sort of a green fuel. You know, this is trees, they're natural, we just cut them down, they grow up again, you know, it's great. And there may be ways to actually utilize it in an efficient and a green way. But in general, we burn it in a very unregulated way. And it's a source that's really sort of, we're still burning wood with 200-year-old technology. I mean, a fireplace today is no different than a fireplace 200 years ago. And we know that it's actually got a big impact on air quality, especially during cold periods when we have very low wind speeds. In terms of sort of the heating potential, for the heat energy that you get, you have 2,000 times more pollution if you burn wood in a fireplace than if you burn it in an oil furnace. And even sort of our fanciest kind of wood stoves today, they still emit about 40 times the pollution per amount of heat you get out compared to something like an oil furnace. So they're just really inefficient in terms of the pollution you get for the benefit. What we did a few years ago was actually drive around making measurements in the middle of the night in the winter. Yes, I'm crazy, I do this kind of thing. And measured wood smoke. And we did this repeatedly throughout the winter. We got something like 12,000 data points. And what we found is that there are parts of the Lower Mainland that seem to always, in winter conditions, have high levels of wood smoke. These tend to be sort of low-lying areas, especially low-lying areas with older homes, older subdivisions, which is what you'd expect. We can then sort of take this kind of map and then, again, look at this in relation to health data. And what we found is we actually, fortunately, didn't see any links with any of the reproductive outcomes, birth weight or premature births, nothing with asthma, nothing with adult cardiovascular disease. But with those childhood infectious diseases, so bronchiolitis and, again, ear infections, we saw very striking, actually, links there, to the extent that, you know, we're estimating about 10% of the ear infection incidence in Metro Vancouver is linked to people who are exposed to high levels of wood smoke. So just in closing, you know, what can we do about this? So again, Vancouver is very clean, but we see these sort of disparities in health within our area that are linked to variability in air pollution within our area. We also know that if we intervene, if we make changes, we actually get benefits. And there's now actually a lot of opportunities. We're thinking a lot nowadays about changing the way we design our cities, changing the way we operate our cities. We can link with those actually to get benefits. This is a picture of Times Square in New York City. It's an urban plaza now. It used to be a heavily trafficked thoroughfare. They just got rid of the cars and they put benches and tables there. There's been no impact on traffic. There's been a positive impact on businesses and been a positive impact on quality of life. And here's an example where you now have separated actually traffic from a place where people want to be. This other picture, this is actually in Seoul, Korea. This used to be a freeway. It was actually a freeway that was built on an urban stream. We've actually got a lot of situations like that. You know, Vancouver used to be salmon streams, right? We built roads on top of all that. So they actually took this freeway out. They created this urban park. Air quality improved. Again, no impact on sort of levels of traffic. In most of our cities, roads are already saturated, right? They're already full. So if you remove one, it doesn't make a difference. You can't get fuller than full. And people actually find ways then to get around without driving. So you actually kind of create these spaces where you get benefits without actually having really a negative impact. And I was actually just in Munich, Germany 2 weeks ago, and here's another example. So this is a freeway here. You can see a picture of it. They basically now tunneled the freeway and created a park on top of it. So the road is actually still there, but for the people who live near the road, now they're not actually exposed to the air pollution. It gets ventilated and actually filtered and cleaned, and they have this wonderful park in the middle of the city. So there are ways that we can do this. And we can also think about providing opportunities for people to get around without using cars. So thinking about, biking, walking, et cetera, for everyone in society. So I will just close there and just leave you just with this slide. For anybody who's interested in learning more, we've worked with Health Canada on developing sort of an online course. This is especially geared towards health professionals, but it's open to anyone in public. It's free. You can kind of go through this. It's got little video clips and a discussion format and provides a lot of useful information. So thank you.
Thank you very much for the opportunity to be here tonight. I'm going to talk a little bit more about all these things that Michael talked about, the associations between different diseases and air pollution, and drill a little bit more down, as he said, on why this happened, why it happened that you inhale particles or air pollutants, and in the end you get a heart attack or get a stroke or get pneumonia, or all these other things. So I'm going to talk about the mechanisms, and I'm going to try to illustrate it with other studies and also studies that have been done here in St. Paul's Hospital. So I also have a little bit of an introduction before I get to the hardcore things. This London fog in 1952 was actually one of the first pollution episodes that have put pollution on the map as a cause of mortality. During that period of time was actually a period of 5 days that there was an inversion in London. In those days, in London, they've used mostly coal to heat the houses. And during that time, you can see from this red line how the air pollution particles, and here they've plotted again particles that was in the air. What happened with death during that period of time? It was just 5 days, and within a day of this thing spiking up, the deaths started to increase. So that was the first actually incident where it was very well documented that if you get a spike in air pollution, you also get a spike in mortality. And since then, there was actually studies done right across all 5 continents. And most likely, the most notable study was actually the 6-city study. And that was a study that was done in 6 different cities in the United States. 3 of those cities was fairly polluted cities, and 3 cities was actually fairly clean cities. And the only thing that the researchers did is they actually followed these people over a 16-year period of time and shown that the people that lives in the polluted cities, more of them die than the people live in the clean cities. And actually they've done a follow-up study on this where they've actually started to clean up those dirty cities, and that could show as those cities get actually less and less polluted, the mortality over time also decrease in those cities. So this study was actually the first study that have suggested a cause and effect, that you have a specific thing that we think caused something, and then you take that thing away, and then you take that the mortality away. So this was actually the first epidemiological study that actually proved that. The other thing that these studies have actually shown is if you look at air pollution particles, the ones that actually are the most strongly associated with mortality was actually the particles. So that little haze that you see over the city, when it's a very nice summer day and there's no breeze or no wind, That haze that you see over city, that particles are actually the things that's the strongest associated with the mortality. This is a lung of a patient that lives in the city. This patient never smoked, but you can see the lung there's a lot of black in the lung. And that's actually the carbon that's in that particles that I talked about. That is deposited in the lung, and unfortunately, if they reach the very low or the deep parts of the lung, it's very difficult for the lung to get rid of these particles. Just to put it in perspective, this is the size of a hair, and this is the different type of particles. With particle research over the last 20 years, we've realized that the size of the particle also make a very important contribution of what is the health effects. And we classified particles as particles that is coarse particles, and that is usually particles less than 10 microns, more fine particles less than 2.5 microns, and the very small ones, or the ultrafine particles. And each one of these different particles actually have different biological effects in the human. This is the respiratory system, and you can imagine the bigger the particle, the smaller the particle, the deeper it will penetrate into the lung. So your coarse particles will be taken out in your nasal passages in your larger airways, while the very fine particles will reach actually the alveoli, or the little sacs in your lung that are responsible for taking up oxygen and getting rid of carbon dioxide. This is just a photograph of particles, urban particles collected by Health Canada. You can see all different size of particles. The other important things that have actually been determined over the last time is that particles are actually not just it's not a simple component, it's very complex. Most of these particles that you get when you burn fossil fuels usually have a carbon core, but onto that carbon core there's many other substances, like for example hydrocarbons, metals, and biological things like viruses and bacteria and things. Especially if these particles are small and they float around for a long period of time, they tend to pick up other things. And in the end, we inhale those particles. We know in British Columbia, it's a place where every summer we get forest fires or wildfires. And last year was a particular bad year. We had 1,600 fires. This is the amount of hectare that it actually covers. We know that the interior are actually the hardest hit. And Williams Lake, actually, when they measure these particles, they've actually set a record last year for how high the particles went. And that level of particles is actually very similar to the levels that was reached in the London fog when so many people died. So it's actually very, very high levels that these things actually reach. And Michael actually pointed out the bad effects of these things. This is just a slide from the Kelowna fires in 2003, and you can see very shortly after the fire started, you can see more admissions to the hospital for respiratory conditions like infections of the upper respiratory tract, lower respiratory tract, asthma, and COPD. We've been involved in a study where we've actually want to try to find out how these wood smoke affects people, and we selected to use firefighters because we can study them when they're in their boot camps in the beginning of the season, when they sort of train for the season, and then study them again during the time when they fight fires. And these cells are actually cells that we get from their lungs after a day of firefighting. These cells that are called macrophages are the cells that lives in your lungs, and actually is like vacuum cleaners. They keep your lungs clean of any foreign things that gets into your lungs. And you can see these cells are full of these particles. Now, when these cells see these particles, obviously they sense danger, and they will make a lot of inflammatory mediators that elicit the inflammation into your lungs. We've also measured some of these cells that they attract, like this one, that's primary function is to kill bacteria. these things get entracted into the lung, cause lung inflammation, and you can see we've measured them in the sputum, and during the period that these firefighters were exposed, they were significantly higher than when we measured them during a time when they would just do their normal basic training and they're not exposed to the wood smoke. We were also interested, if these firefighters then do get a form of lung inflammation from the particles, what happened in the blood. And this is one of the mediators that these macrophages make that we measure in the blood. And you can see that this mediators was significantly higher during the time that they were exposed. And we just did this control to make sure it's not the exercise that do that. So what it actually basically means is that you get this inflammation in the lung, but there's also some of this inflammation that spill over into your bloodstream. And that actually pertains to what is the effect of these inflammatory mediators that spill over into the bloodstream then on your blood vessels. Just before I get to that, I just want to also just show a couple of slides where we've actually confirmed this finding. And this was when they had this big fires in Southeast Asia in 1997, where we've actually studied 30 army recruits that was busy doing their training outside during that period of time. And here you can see, we did the study in Singapore, and here you can see what is the normal particle counts in Singapore. And during that period of time when they had the big fires, that particle count actually significantly increased. We measure some of these inflammatory white cells in the blood, and you can see during how significantly it actually decreased after the fires actually was washed away by the monsoon rains. And this slide actually just demonstrates these cells, all the time points that we collect blood from them, how it decreased, and it sort of mirrors the effects of the particles that we've measured during that period of time. Sort of to show that there's an association between the increase in these inflammatory cells in the blood and also the pollution. We've again measured some of these mediators and could show that they were higher during the haze and decreased to more normal levels after the haze was cleared by the rains. So if we then show that there's inflammation in the bloodstream, what does this inflammation do to the blood vessels? So we know that the most commonest blood vessel disease that are responsible for strokes and heart attacks is called atherosclerosis. Now, this is a disease that actually originates when the blood vessels are under stress. Things that may stress the blood vessels are maybe toxins, maybe high blood pressure, lipids, etc. When you stress this interior smooth layer of the blood vessels that we call the endothelium, it becomes more permeable, and these white cells and things like lipids or cholesterol can actually get into the wall of the blood vessels. And over time, it will form a thing like that we call a plaque that contains a lot of these white cells, usually a lot of lipids, and usually one of the ways that the body tried to protect or keep it away from doing damage to the vessel is by forming a fibrous cap over top of that plaque or all that cholesterol that's in the wall of the blood vessel. Now, usually if one of these plaques undergoes stress, they can rupture and they form a clot, and that will block off that vessel, and that's how you get a heart attack or a stroke. So our question was, if people that are exposed to air pollution get heart attacks and stroke, can we actually prove that air pollution do something to this atherosclerosis or to these plaques? So to show this, and we were actually the first to show that this actually happened. And to do this, we've used an animal model. It is inbred rabbits that come from Japan, and these rabbits are actually develop atherosclerosis very similar to humans. They have a genetic defect, and they die very early. Very seldom that these rabbits naturally live longer than 2 years because they get heart attacks and strokes just like humans. So we thought this will be a very good model to look at that. And we have actually exposed these animals to about the same amount of pollution that you will get when you live for 3 months in a fairly polluted city, and could show after that period of time that they got more atherosclerosis. And then if you relate that amount of atherosclerosis in the coronary arteries or the arteries of the heart to the amount of pollution, you get a very nice relationship. So the more pollutants we find in the lung, the more atherosclerosis the rabbits had. We've also looked at the cholesterol in these plaques, and we could show that there was more cholesterol in the rabbits that we've exposed to the air pollutants. And the air pollutants that we've used for this study is actually air pollutants that we got from Health Canada that they collected over Ottawa. So that's the things that people that live in Ottawa naturally inhale on a daily basis. It's not something unusual. Most will be the same as here in Vancouver. So, we've actually done a lot of other things also, but in summary, what we've shown is if you get one of these plaques, normally these plaques are stable if they have sort of a core of lipids with a nice thick cap protecting it from rupturing. What we've shown, if you expose these plaques to air pollution, they get more lipids in them or more cholesterol, they are more cellular, they got more cells in them, and this protective cap over them is actually much thinner. So these make these plaques much more vulnerable to rupture under stress conditions. We've also looked at the function of these blood vessels by just exposing them to different things that normally dilate and contract arteries. And we could show, this is an example looking at substances that normally dilate arteries, that these arteries don't dilate as well as arteries that in the animals that wasn't exposed. So in summary, this study actually shows that there's actually changes in these plaques when you expose these animals to air pollutants, and that these blood vessels also doesn't function properly. Is that true in humans? And I think Michael have already shown one of these graphs. This was actually a study that they've done in Los Angeles, and basically what they've looked at people. They've measured the thickness of the arteries in the neck, or the carotid arteries, and see how much atherosclerosis is in those arteries. And they've just looked at different people that live in different areas of LA with different levels of pollution. And they could show that as you live in an area with more and more pollution, you got more and more atherosclerosis in your carotid plaques. So that will put you at risk to develop strokes. What about the heart? This was a study that was published in Circulation, and there was actually an editorial in the New York Times that they say the closer a person lives to heavy traffic, as Mike pointed out, the more likely you develop, the more atherosclerosis you have in your blood vessels. And that is that graph that he showed. This is actually, they've used, in this study, they've used a technique that are very commonly used now to screen people for atherosclerosis by doing CT scans of their chest and look at how much calcium is in their heart blood vessels. And they've shown that if you live near traffic, you've got more calcium in your blood vessels, and if you've got more calcium in the blood vessels, you also got more atherosclerosis, showing the association between exposure by traffic living near a big artery route. So if you summarize what is the clinical effects of air pollution, we can summarize it basically in these 4 points. That if you are exposed to excess air pollution, your chances of being hospitalized is higher. Usually you are hospitalized for things like pneumonia because you're more vulnerable to get infection. Air pollutions actually decrease your defense systems in your lung. You're more likely to develop exacerbations of your COPD or asthma. You get more heart attacks, more heart failure, and you get more strokes. And there's many studies that have support all these clinical things. It's usually predominantly the people that are affected by air pollution is the very young and the very old. And they're very young because they're still vulnerable, they're still growing, and they're very old because they've got underlying conditions that are aggravated by the air pollutants. And as I pointed out, it's the particular component of the air pollutants that are actually the most damaging. So if we can summarize, if you breathe in air pollutants, you get some lung inflammation. That lung inflammation makes you vulnerable to get pneumonia, asthma attacks, and COPD. You also get a bloodstream inflammation, and that bloodstream inflammation impact blood vessels. It impairs the function of the blood vessels, and it can also change the plaques that you normally have in your vessels, make them more vulnerable to rupture and cause heart attacks and stroke. I didn't say very much about industry and air pollution. We don't have a lot of big industry polluters here in Vancouver, but obviously in certain areas of the country and the continent, it's a big problem. And there's actually a website, if people are interested in that, from the American Lung Association that they can go to read more about industry air pollutants. I just want to thank everybody that's involved in all these studies, and we can say that breathing clean air promotes heart and lung health. Thank you very much.